You guys have done some of the very best clinical conferences I've seen.
When I was first asked to support the nomination of Nancy, of course I reflected on the lives of Mary Lucretia and Sarah Emily, but especially Sarah Emily because of her founding of St. Joseph's Hospital. And I was in awe of their leadership that was born out of a pure compassion to serve those that were the most vulnerable and alleviate their distress. And I think Nancy lives that legacy of serving in a compassionate manner to the vulnerable.
Do you remember the book you read when you guys were freshmen, Tattoos on the Heart? How he talked about not judging people, but rather being in awe of the difficulties they carry.
One of the characteristics that I automatically think of when you're talking about a nurse is being a compassionate nurse. Dr. Shirley has gone above and beyond her profession to teach the nursing students what compassion really means. Dr. Shirley has really driven her passion of being present with patients, being present with people, trying to understand the framework of where patients are coming from, the social aspects of what it takes to be in healthcare, learning about the community as a whole and what patients may be struggling through, such as social concerns, financial concerns. And Dr. Shirley has really taught us how to look at the bigger framework of healthcare, seeing how different policies affect the healthcare systems and how, as nurses, we can be not only the nurses, but the social workers, the teachers, the educators, and really trying to be present with our patients and also learning all about different aspects of their lives instead of only their health.
We talk about Nancy's service with Creighton and with ILAC and Omaha and the DR, but Nancy has also extended her service by selflessly serving her country for over 20 years as an Army Reserve nurse. This was at a time when there was a military shortage of nursing to care for those, especially that were in combat in the Mideast.
She really thought that the retreat was really helpful for you, and so I was so pleased to hear that.
Nancy has actually a fairly extensive and tireless work in creating a supportive environment for local women that have experienced both homelessness and addiction. She stated that her involvement in these retreats is because she sees the retreats as providing hope and a connection to God. She sees her role as reaching out to someone and helping them make those connections. And she said, it's a passion.
Everything that we are doing as nurses is really for the greater glory of God, giving everything that we have and surrendering to His call for us to be nurses is something that Dr. Shirley has really been passionate in teaching her nursing students about.
Nancy may not actually be building the hospitals or founding the hospitals that Sarah Emily found, but I think Sarah Emily would be proud in that Nancy is building a caring and compassionate workforce that lives on and extends well beyond the boundaries and the walls of any hospital.